Welcome to the Catalyst Webinar and Dialogue Series Kickoff. I'm Kendall Marlowe with the Kempe Center for the Prevention and Treatment of Child Abuse and Neglect, and I thank you for joining the global community driving change in child welfare. This October, we come together again for the virtual Call to Action to Change Child Welfare Conference. This annual convening of people from across the world aims to transform child welfare and build justice and equity, all through honoring the voices of those impacted by child welfare systems. In both policy and practice, our passionately shared goal is meaningful, lasting transformation. We're here today to begin a webinar series to take the first step on this journey. In every session of this series, we'll explore actionable initiatives that will come to life in our conference in October. We'll venture unafraid into the heart of child welfare, its history, its impact, and its future. We'll address and even challenge the core structures, policies, laws, and values that have governed our system throughout its history. And we'll ask ourselves, where must we go from here? Following each webinar, we'll then host a dialogue. Those conversations are intended to foster open, honest, and challenging debate. We invite you to join us at each webinar and then share your voice in each dialogue that follows. If you're viewing this webinar from within Attendee Hub, we encourage your questions and comments throughout the presentation by using the Q&A feature. If you're with us through Zoom, you can use the Zoom chat box function to engage, and we'll have time at the end of the presentation today to address those comments and questions. Let's take that first step together with today's webinar session. It's a privilege and an honor to welcome Mical. Mical is a professor of history and an endowed chair of public policy and health at the University of Rochester, a scholar of health policy history, a doctor, and the author, among other works, of What's Wrong with the Poor? Psychiatry, Race, and the War on Poverty. Mical, thanks for being here today, and take it away.
Thank you so much. Let me just make sure my slides are up. Thank you for inviting me, and I'm excited to be here and share some of my thoughts about mandated reporting and its relation to the child welfare system. So, experiencing a child abuse investigation is a practically commonplace occurrence. It's estimated that 1 out of every 3 children in the United States will be the subject of a child abuse investigation before the age of 18. And amongst African American children, where the figures are even higher, we're talking about more than half of all Black kids in this country will experience an investigation by the age of majority. That's quite a number. 1 in 100 children, of all children, not just kids in foster care, 1 in 100 of all kids nationwide will experience involuntary termination of their parents' parental rights, or what some researchers have called a state-induced parental loss. These numbers are really staggering, but they don't indicate an increase in child abuse, quite the opposite. We know that there's been a steady decline in child abuse over the past decades, and in fact, the majority of substantiated cases of child maltreatment deal with neglect, and many are related to substance use. Over the past half century, the child welfare system has transformed itself into one that investigates and regulates behaviors, and all too often punishes parents for their poverty while prioritizing investigations rather than the provision of services. And this has a history. Since the 1970s, we've seen a vast shift in what we consider to be child abuse and neglect, and a concurrent expansion in coercive intervention by the child welfare system. Parents are afforded less freedom to make decisions for their kids, such as letting them play unsupervised in a playground while mom works, or wait in the car while the parent runs a quick errand. These things, we can't even make those decisions anymore because it's too dangerous, even though we know that actually society has become much safer with lower rates of violent crime. Parenting has been transformed into a constant role of vigilance and supervision. But this is absolutely divorced from the actual risks. But this emphasis on being constantly vigilant disadvantages low-income parents, particularly mothers, who need to balance work, childcare, and these expectations of constant heightened supervision in a society that fails to offer basic standards of supports for mothers, such as, guaranteed maternity leave, sick leave, or subsidized high-quality childcare. So how do we set up the system in which we regulate families, and which sets up poor families for constant investigation and essentially for failure. How can it be that one out of every third child in this country will be a subject of a child protection investigation? So one of the main factors in shaping this process, in my understanding, is the rise of mandatory reporting and the embrace of reporting as a primary response to a struggling family or to a child in distress. Today, there has been a growing recognition of the unintended consequences of mandatory reporting policies and how these expansions of what you have to report and what can reporting actually do essentially leads to harm to children and families. And I'm going to talk a little bit about the history of this. And so since we're at the Kempe Center, we're going to start with Dr. Henry Kempe's discovery of child abuse in 1962. And at that moment, physicians and policymakers embraced this idea that if we could only report more, it would help us detect children at risk for abuse. The idea was that child abuse is generally something that is rare, and would result in occult physical injuries and fractures. So doctors were the ones who seemed to be the most, best equipped to detect abuse and help prevent it. And this also speaks to a broader moment in history of medicine, in which there was a focus on public health interventions and early detection and screening in primary care and in other fields. So this helped set the stage for an early focus on mandatory reporting. If only we could detect early and intervene early, physicians could help prevent child abuse. And in 1963, the Children's Bureau of the United States Department of Health, Education, and Welfare, they published model statutes for individual states to adopt as they developed legal requirements for reporting child maltreatment. And these were primarily targeting physicians. This is 1963. By 1967, 49 states have passed child abuse laws with a mandatory reporting requirement. So each state is doing their own thing. And then in 1973, we have the Child Abuse Prevention and Treatment Act, CAPTA, signed into law in 1974, and states further expand their mandatory reporting requirements in order to meet the federal minimum. Some states even went ahead and adopted a universal mandatory reporting approach, which means that every single adult is a mandatory reporter. Despite a dearth of evidence, many believed that more reporting made children safer. Yet states and local agencies varied greatly in what they defined as reportable suspicions of child abuse and who should report. As a result, there were many attempts to try to develop model legislation guidelines. And while there was a lot of time and effort that went into these model legislation attempts, they remained unsuccessful, mainly because of a lack of consensus as how broad a definition of abuse was appropriate and how we could avoid targeting certain marginalized populations. This might ring a bell because this problem persists today. There's a lot of debates about what is the right amount of reporting, but there's no guidelines to adopt or no proposal on the table that this is the better version of this. So today I want to talk a little bit about how mandatory reporting became entrenched as a main feature of child abuse policy. So I'll talk a little bit about hotlines first, and then talk about a few attempts to try to set this up with guidelines and legislation and what we can learn from that. So in the early 60s, as states were scrambling to pass mandatory reporting laws, and we're talking about 49 states scrambling in 4 years, there was little data to guide these questions. Who should report? What is reportable behavior? And also the question remained, what should happen after a report? And it became pretty clear that many child welfare agencies didn't have a concept of how reports should be addressed. And I'll just give one example. So as early as 1973, a nonprofit social services agency noted that reporting should not be an end in itself, and made the rather obvious yet necessary observation that just because you investigate a child who's suspected of being abused was not actually helpful unless there were appropriate services. Contemporary child abuse policy interventions centered over how to encourage reporting and raise awareness, rather than the subsequent provision of services. And now I'm getting to the part where I have slides, don't worry. Hotlines emerged as a preferred technology for implementation, as they were able to accommodate steep rises in reports without, or so it seemed, a need to increase in salaried positions. All you have to do is have a phone line. And so in some ways, focusing on hotlines was a form of political theater. We're pretending to do something, or we're doing something that's very visible to prevent child abuse, but all we're doing is opening a phone number and having people answer. So Florida is the first state to implement a child abuse reporting hotline, and this happens in 1971. The state began publicizing a toll-free 24-hour hotline, and the numbers of reports increased from 17 reports of child abuse in 1970 to over 19,000 in the following year. So I'm clearly not saying that 17 is the right number of reports, but this is a significant increase. Yet state politicians made no funding appropriations to deal with the increase in reports. And what were child welfare agencies supposed to do with all these cases? And at the same time, Florida launched a statewide awareness campaign that was tagged "Who Would Hurt a Little Child?" These ads featured pictures of cute kids and said, "You could save a life." And they ran on television, billboards, and radio. So 19,000 children, this is a 30-second ad. Last year, over 19,000 Florida children were beaten, burned, neglected, sexually assaulted, tortured, and murdered, mostly by their parents. Okay, this is horrifying, absolutely horrifying. But neglected is doing a lot of work in this. So a very small number were subject to these terrible abuse. And then most of the children were subject to what we call, suboptimal parenting. And I'm just going to read from the data that we have from the time, which said that almost all of these reports did not deal with the terrible abuse, but rather with malnutrition, physical neglect, disorganized family life, alcoholism, abandonment, and a lack of food, clothing, or shelter. And here we have another one. Who would beat a little child? Last year, thousands of people throughout Florida did. These parents are sick, and you can help them. So in some ways, it used the increase in the reports to argue for more reporting, right? Because all these reports come in about children who are primarily suffering from the impact of poverty. And as a result of that, they say, well, we need more reporting because we had so many reports about things that are absolutely terrible, which speaks to a larger trend of lumping together all kinds of suboptimal situations for children, both horrific abuse, physical, sexual abuse, but also manifestations of poverty in order to generate essentially a panic over these numbers. But Florida's hotline and advertising campaign were actually considered a success by many advocates. You got lots of reports, you're doing something, you're showing evidence of an intervention. And other states modeled their reporting systems accordingly. In Pennsylvania, Senator Mical, a Democrat, pushed for more expansive child abuse legislation and championed the hotline model. He and his colleagues helped develop Pennsylvania's Child Protective Services Law, which passed at the end of 1975, which created the state's first child abuse hotline, a sign of the times, because 1971 in Florida, and gradually all the states end up having one. But this story is slightly interesting because it didn't go smoothly. From the very beginning, policymakers feared an explosion in reports and that there might not be enough personnel to address them, which could detract from the care of children at risk. In fact, the Pennsylvania State Association of County Commissioners were so concerned about the hotline that they adopted a strong word resolution, essentially saying that if it were to happen, they would not implement it. Well, they did. Over objections and concerns, in March of 1976, the hotline opened. The following month, this is a picture of the hotline, 885 reports were filed. A third of all of those had been filed the prior year. So in total, over 6,400 reports were investigated in 1997, 1976, the first year after the hotline, which was more than double the previous year. And the year after that, it doubles again to almost 13,000. But contemporaries wisely did not think that just because we have more reports, this is a sign of success, because more wasn't seen as better. And at a 1977 meeting, the governor at the time, Governor Shapp, met with Opaque and all the child welfare leaders, and they talked about the legislation. And they said, well, it's great that you can report, but it's a problem that the definition of child abuse is too broad. There were too many inappropriate referrals and inadequate funding for prevention and research. So I'm just kind of flagging this because these are problems that have been recognized for decades and that persist. And often we talk about unintended consequences, but sometimes we should be talking about clearly foreseeable consequences, that there were moments in which perhaps we could have done something differently and we didn't, which is instructive to think about today how we might want to change policy. So despite everybody being so concerned about how these reports are just bringing more reports, there was no actual change. In fact, a survey of Pennsylvania Child Welfare Agency directors found that many didn't like this new reporting. They thought that many of the reports coming in did not require investigation and that there should be a way to screen out family dysfunction. They were worried about lumping together physical abuse with all the other reports, which they didn't think belonged together. And most of them said that the problem with the base was that there was an overly broad definition of child abuse and an overly broad mandate for reporting. But despite criticism at the very front line, local policymakers did not make any changes. And that's going to be a refrain you'll hear today. So neither Florida nor Pennsylvania are outliers in child abuse reporting. I talked about 2 states because I can't talk about all of them, but we can talk about nationwide data. And there was a steady increase in reports of child abuse and neglect through the 70s. Data from the American Humane Association indicates a 75% increase in reports nationwide between 77 and 78. And so it goes from 110,000 in 1977 to almost 200,000 in 78. More than half of the reports were not substantiated, and only a small percentage involved substantiated physical abuse. And the vast majority had to do with neglect. Of the substantiated ones, of course, the vast majority are unsubstantiated reports. Race clearly mattered. Data from 1978 showed that Black Americans were the subject of 19% of all reports made, even though they were a little under 11% of the population nationwide. And Latinos were the subject of 8% of all reports, again, an overrepresentation in comparison to their population. Income and race tracked closely, and both were associated with child abuse reporting. And in this slide, we see that families in the lowest income bracket, which means annual incomes under $5,000, which was well beyond the federal poverty line at the time. That's where almost half of all substantiated reports of neglect were coming from. So poor people are getting reported for neglect, and these reports are being substantiated. By the late 1970s, it becomes abundantly clear that a policy that focuses only on reporting disproportionately impacts low-income and minority families, and that only a fraction of these reports actually involves physical harm to children. In 1978, Yale child psychiatrist Albert Solnitz summarizes over a decade of mandatory reporting requirements in a talk with a pithy title, "Too Much Reporting, Too Little Service." Like many before him, he argued that the definitions of child abuse were too broad and that this epidemic of reporting was not matched by an increase in services for children. Policymakers, however, pushed the opposite approach. Legislators at state and federal levels pushed to expand definitions of child abuse. Federal policymakers encouraged individual states to adopt legislation by leveraging CAPTA requirements. So if you don't expand to include emotional neglect, you won't be eligible for CAPTA money, and making sure that each state generally broadens their requirements. As states develop their own mandated reporting requirements and try to come in line with CAPTA, all these new discrepancies open up. And it becomes a problem to how do you quantify and compare data from different states if each state defines it differently. To address this, the policymakers pushed to develop model legislation as a basis to have consistent state laws. And I'm going to talk about a couple of attempts to develop model legislation so we can learn a little bit from this history. In 1975, the Education Commission of the States, which was a policy think tank, went and tried to revise CAPTA and think about model statutes. And this is an interesting story, I think, because it speaks to how we make the policies we have and how we evaluate evidence. Oh, that's that slide I missed. Okay, so Head Start pioneer Joel Sugarman was one of the folks involved, and he was a well-established educator. And we're talking about penalties for not reporting suspected child abuse. And here, Sugarman is recommending against penalties for failure to report, arguing instead that rather than punishing people for not reporting, maybe we should focus on what are barriers to report. Penalties, he worried, could lead to unnecessary reports. And if we have too much reports, it would deter families from seeking care they needed. He was not the only one to object. And here is this: we have significant reservations about penalties for failure to report. This is from 1976. And they thought that this is not a useful policy and explained why, or many of the task members. At the end, though, in the recommendation, they had decided to include significant penalties for non-reporting. And they decided to define failure to report as a misdemeanor and to hold the individual who failed to report as liable for damages. This is a very high bar, quite punitive penalties. And they tried to explain why they did this, even though there was so much debate and so many people who objected. And then they said, well, we weighed back and forth, and ultimately we decided that there was, quote, no substantial evidence to support the argument against the penalties. which is, I think, quite interesting because that's not how things work. You need to have evidence to say something works to include it and expand it, and not the opposite. But this is one example of many of policymaking in the absence of evidence. From the very beginning of thinking about mandatory reporting, there was no evidence that it worked. It was based on an idea from public health that if we have early detection, we'll be able to find quicker. And then expanded mandatory reporting, and then adding these penalties and expanding them, but again, without any evidence that this is actually effective. So I wanted to flag this episode, which is kind of getting in the weeds, but it shows how recommendations become so well accepted. And we say, okay, well, that's how we've always done it, or there must be a reason we have penalties. But sometimes the answer is no, there's not. That's just how things ended up from how the politics played out. And in fact, there was no evidence to support the idea that a lack of penalties was a factor in non-reporting. The year before this committee came together in 1975, Ray Helfer, who was a pioneer in child abuse studies, tried to break down the barriers to reporting, and he particularly noted a lack of training, a lack of time and resources, doctors who don't want to get involved in unpleasant situations, so many different doctor-related barriers. At the same time, a survey of US physicians found that almost 100% of pediatricians thought physicians should report child abuse. It was 98%. You almost never get 98% concordance. So everybody thinks reporting should happen, and there's barriers to reporting, but there's absolutely no data that decisions to report were influenced by lack of penalties. But despite that, penalties for non-reporting become an important part of child abuse legislation and continue to be expanded with subsequent revisions of state laws to this day. These penalties seem to make good sense. And for politicians, they serve as evidence of being tough on child abuse. We're putting penalties for non-reporting, although they have never actually been examined to see if they're based on evidence. So I'm going to talk about another historical episode now, a different story, which I think is also instructive because it tells you a story of what could have been or what people were thinking about also at this period of time. So in 1974, the Federal Office of Child Development awarded a grant for the development of model legislation. And they had a committee of 42 experts on child maltreatment from across the professional spectrum. And the effort was led by a legal scholar and a researcher, Alan Zussman, and researcher Stephen Korn. And I'm flagging this episode because this work on reporting child abuse was really a journey. Initially, they believed that the best approach was to require broad reporting, and they document that. But the more they learned and looked at the data and evaluated what states were doing and what experts were saying, they realized that they had created a system of reporting sanctioned and encouraged by the law, which could invade and harm the lives of parents and children as easily as help them. Furthermore, they added an overemphasis on reporting distracted from the societal problems underlying most of these cases, such as poverty, unemployment, lack of childcare, lack of housing, and so on. Too often, mandated reporters believed that once a report was filed, help was forthcoming. This is kind of the checklist mentality that you want to help a kid, you call a report, and then you're like, okay, I'm done. I can cross that off and I can move on. But that's often not the case. Services were often substandard and could result in the unnecessary removal of a child from the parent's home, but with no plan in place for further assistance. So at the end of this really large review that was led by these two people, but included many experts and a large analysis, the authors argued for a narrow reporting requirement that would focus primarily on serious physical injury or severe neglect. So this is a story about how you have a research that leads to unexpected conclusions that are unpopular. And so this could have been a moment of changing course. Instead, this book, even though it was the research was funded and there was a lot of expectations for these findings, once they came out and they were not what was hoped for, the book was ignored and forgotten. So this is a story of a missed opportunity for a comprehensive review of data about mandated reporting, really only 10 years after its implementation, how this opportunity was discarded and lost. So we could have rethought this based on this study, but we didn't. And I'm going to tell one last story, a historical story, and then I'll talk a little bit more about what I think are lessons for today. So in the mid-1970s, at the federal level, the Department of Health, Education, and Welfare attempted to develop its own model legislation and to require states to adopt it as a condition of funding. And this is after CAPTA passes, and each state kind of struggles to meet CAPTA's requirements. And so there was an idea, if we had model legislation, each state could just adopt it, and that would be a lot easier. And the statute that they developed would have significantly expanded mandated reporting, especially in cases of neglect. And many advocates were alarmed. And I'm going to flag one advocate or one politician, and that is Senator Walter Mondale. And Senator Walter Mondale was actually the champion of CAPTA. He's the guy who brought CAPTA. And so he now objects to this new effort to develop model legislation. And why is that? Well, he says, the government has a responsibility to safeguard families, particularly those who are from poor and minority groups, from being enveloped in a system which may label them permanently as criminal or deviants, which also lack the resources to give them necessary services. And Mondale said, if the government goes ahead with this model legislation, he would, I'm going to quote, personally write all our state legislators and recommend that this not be adopted. So he's not the only one who spoke up against this, but it was pretty notable that he did this because he was the guy who brought CAPTA. But a bunch of different family defenders and advocates for minority groups also were worried what an expanded law for mandatory reporting might bring. So ultimately, this model legislation was quietly dropped. So to this day, there's no required model legislation, although CAPTA and its various iterations sets the federal standards for reporting requirements. It's probably a good thing that this model statute, the one that Mondale objected to, failed, because it would have been overly broad and all-encompassing. However, the fact that we don't have clear federal guidelines and model legislation leads states to develop their own reporting requirements that have similarly unintended consequences. We have a lack of standards defining child abuse and neglect, and clear interstate differences in requirements and definitions, which makes it really hard to interpret data because each state kind of does its own thing. It's also hard to assess whether certain child abuse prevention interventions are effective when states have different ways to define child abuse and to measure its prevalence. So mandatory reporting and this focus on investigation rather than provision of services emerges as a main legacy of 1970s child abuse policymaking. Despite a dearth of evidence of effectiveness and a lot of concerns about its unintended consequences, mandatory reporting continues to be the mainstay of current child abuse policy, with very few exceptions. Nobody wants to be seen to be against reporting child abuse. Notably, in 2005, Gary Melton argued that mandated reporting is a policy without a reason. And after him is the name of this session, which harkens to this article. And he argued that by focusing on reporting investigations, resources and attentions were shifted away from promoting child safety through the provision of social services and becomes essentially focused on investigations. It also changes how both the general public and professionals who care for kids respond to children in need. Rather than working to assure a child was fed or clothed, for instance, bystanders or professionals might instead feel compelled to report parents for concerns for neglect. In this way, Gary Melton argued, mandated reporting, I'm going to quote, transformed public child welfare agencies into investigatory bodies with limited involvement in the provision of social services. Expanded mandatory reporting seems like good politics. It is non-controversial, non-costly, and has the appearance of protecting children. And this approach flourishes from the 1970s and onwards. Despite criticism over the decades, little has changed, although now we are finally at the moment where there are a lot of conversations we can have about this. Mandatory reporting is a compelling framework by which to address child abuse, and almost at any juncture when something bad happens, then policymakers go towards more reporting. In Pennsylvania, in the aftermath of the Penn State child abuse scandal in 2011, when it came to light that a popular coach, Joe Sandusky, had sexually abused teens over decades, the public focused on the failures of multiple adults to report allegations of sexual assault over the years. In response, Pennsylvania expanded its reporting requirements considerably, as well as requiring training in child abuse, and kind of passed a slew of laws about child abuse. 24 pieces of legislation that amended the state's Child Protective Services law, which had passed in 1975, which I showed you earlier. And most of these effects were to expand the definition of mandatory reporting and to expand the definition of child abuse. As a result, Pennsylvania saw a significant increase in the number of child abuse reports made to their hotline. Predictably, while the overall number of substantiations increased, the substantiation rate went down. So you're looking on the one side, you see child abuse reports from the period before the change in the laws. And then the other side is 2019, comparing it to the previous years. And on purpose, I'm stopping at 2019 because the data gets a little wonky during the pandemic with big dips that are related to pandemics. So we see that there's a huge increase in reports and that the substantiation rate goes down. Because of course, when you have a lot of reports, then the rate of substantiation goes down. But also overwhelmed caseworkers who are burdened by high numbers of children without any increase in funding can miss cases that are in need of immediate attention. And I'll show one more. This is a slide about child fatalities. And we see that child fatalities and near fatalities went significantly up in the years that were after the big changes in policy in Pennsylvania, after the passage of all these changes to child abuse reporting requirements. So thankfully, child fatalities is a rare event, and it's hard to make any big sweeping statements off cases of child fatality. And there's certainly other factors at play, including opiate epidemic in Pennsylvania and potentially different ways of attention and measurement of fatalities. But it doesn't seem that an increase in reporting has been associated with a reduction in severe injury of children. So understanding of that practice can help us think about other policies. I'm going to stop here. Okay, so now I'll talk a little bit about today. So while it seems logical that mandatory reporting would reduce child abuse, we don't have any evidence that it keeps children safer. It also has emotional and financial costs and takes a toll on our community who undergo intrusive investigations and interventions. It disproportionately targets Black and poor families, funneling them into a punitive system that imposes significant costs on them, including lost days of work, coercive interventions, like safety plans, placement on registries that might prevent them from obtaining better paying jobs. There are also studies that show that parents who have experienced CPS investigations or reports are less likely to engage in valuable services like prenatal care in women who use substances or to get services at school or other community programs. So there's a cost to reporting that might serve to make children and their families less safe or less likely to avail themselves of programs that could have helped them thrive. Also, reporting can result in family separation, even if it's temporary. Removing a child from their parents can be traumatizing. And we know that each year, over 25,000 kids are removed from their parents and returned within 30 days, indicating that the removal probably wasn't necessary. So you can say no harm, no foul, but research indicates that even a short separation can result in long-lasting trauma and harm. And this research, of course, is backed up by any parent's experience or any child's experience that separation is harmful. We know that mandatory reporting results in more reports, and that if we expand mandatory reporting, we get more reports. But more reporting doesn't mean more accurate reporting. And often we're getting more reports of non-abuse situations that overlap with poverty and a lack of resources. And this can often actually divert resources and attention from situations where kids are actually being abused. But you're drowning in reports about poverty and non-optimal situations, and you are missing out on the kids who are at risk. So ideally, doctors, educators, or anyone who interacts with a kid who is worried about physical harm or sexual abuse should take immediate intervention. If we narrow or repeal mandatory reporting, it doesn't mean that people could not or should not report abuse. Instead, it removes a legal requirement that encourages people to report what is not in fact abuse, but often a manifestation of poverty, mental health struggles, or addiction, or family dysfunction that would be best addressed in a different way. So we don't know that all these interventions that are designed to increase report actually improve children's safety. Instead, we should strive for more accurate and more targeted reporting, which has been the recommendation since the 1970s, and narrow the front door to a system of state intervention into families. We also know that in states that have universal mandatory reporting, which means everybody reports, it doesn't mean that there are better detection of children at risk of harm. So I think we have a lot of evidence that suggests that more reporting doesn't result in better outcomes for children. And I also hope that some of what I've showed you from the history has convinced you that a lot of the policies that we've grown to accept as mandatory reporting and assume that they're based on evidence are actually not, and that they might come at a cost that we should be prepared to think about and take into account as we think about best ways to support children and families, and to consider how we can reorient child protective services towards protection and service rather than investigation and punishment to ensure that all children and families can thrive. Thank you.
Thank you, Mical. I want to encourage folks, pop questions and comments into the chat if you're on Zoom. If you're on the attendee hub, there's a Q&A function. And Mical, we've gotten some questions. One question is, how is harm measured? And I would like to expand on that if I could. You just talked about narrowing the front door and an overly broad definition. So how is harm measured? What is harm? If we're going to narrow the door in any way and redefine the kinds of alleged harm that we're going to respond to, how would you do that? How do we draw the line? Help us out.
That's such a great question, because what is harm and how do you make certain harms visible? Because usually if somebody reports a family and there's an investigation and a child is removed, and at the end the child comes back, and it's like, oh, this is a good outcome. And often the harm that the family's experienced remains invisible, although they've lost days of work and it costs a lot of money to get a lawyer and the child has experienced trauma. And so there are different forms of research that try to bring attention to the voices of people impacted by this policy. And I'm going to just talk about a couple things. For instance, there are studies from Manitoba that look at women who were reported and had CPS involvement during their first pregnancy. And in subsequent pregnancies, they are less likely to seek prenatal care. Assuming that we think prenatal care is a good thing, which I think that's a pretty well recognized public health idea, then that would be a clear harm that people are deterred from taking part in a useful public health intervention. There's my colleague Kelly Fong in California at Irvine, who has a new book on investigating families, and her work was with hearing from families impacted with mothers and how this investigations and the requirements that they have to fulfill different programmings, to do urine testing, to go to training, how this impacts their daily life and experiences as parents. And I think that's very illuminating. We can also talk about the experiences of children who are taken from their homes and experience termination of parental rights. And quite a large number of these children never adopted, so they become legal orphans. And I think many would agree that that's a harm in itself when a child no longer has a family and is removed from their kin and communities. And I think some of it also is kind of what perspective are you coming at to this from? And for instance, do you believe that children have a right to be raised within their families and communities? And if that is something you endorse, then the removal or the separation would be harmful. And I'll pause here to see if I've answered that question or somebody else wanted to ask something.
Yeah, let's jump right in. We've got just a few minutes left here. Here's another question. Are you aware of any states that have attempted to tighten up their threshold for accepted reports of maltreatment at screening? Just curious if anyone has been successful in narrowing the front door.
I am not aware. I know Texas has passed some laws that are designed to give parents more rights in the proceedings, and also to help in some ways narrow the interventions and for instance, Miranda right for parents, so parents will know what their rights are when they have CPS involvement, which may in some ways narrow the front door. But I think it's one of the tricky things is that there's no model legislation currently. I think a lot of people are working on this that would be easy to adopt for as a model, like, oh, let's give up the broad definition and adopt this more narrow and useful definition, because this doesn't exist yet, because it's really tricky to get it right. And I think just now legal scholars, advocates are coming together to try to think what would an alternative statute look like. I can say that some states have thought about expanding mandatory reporting, and after hearing from public comment and from key testimony, have decided not to expand. But obviously not expanding is not the same as narrowing. And I am not familiar with states that have proactively moved to narrow the front door in that way.
Here's a question around the types of reporters. Do you know which reporters correspond with reports that are bringing children and incidents of abuse and neglect to the attention of Child Protection? Curious about the relationship to different types of mandatory reporters.
I think a large number are coming from the educational system. And then there's a lot of reports that are coming from physicians that deal with substance abuse infants. And that is that's a growing category of reports. Some of it has to do with understandings or misunderstandings of statutes that deal with testing of pregnant people for substance use. But that is a growing category. We know that reports from physicians and from police officers are more likely, for instance, to be substantiated than from other categories of mandated reporters. And of course, there's the extra complication that in some states, everybody is a mandated reporter.
Thank you for that. Another question, which you might have touched on during your presentation, given that we have many more reports these days than the 1970s, has the substantiation rate changed since reporting is now so high?
No, not really. It's been kind of, yeah, the number of reports has moved around, but I think we were looking around 13 to 15% substantiation report rates. But also of those, a vast majority have to do with neglect and substance use, and then a small minority have to do with physical abuse and of course sexual abuse, which is of course a real and imminent harm to children. It's just not clear that those reports would not have been made had there not been such a broad mandate for mandatory reporting, right?
Here's another question, in a way, asking how we, including researchers among us, can advocate. Is there any data on how social work researchers who have accumulated evidence that something works, is there any data on how they have actively contributed to activism that has their research seen and acted upon?
Okay, I think I understand the question. There's different groups that do advocacy. There's a group called Mandated Reporters Against Mandated Reporting. There's an advocacy group I'm on that's called Repeal CAPTA. I think there's different bodies that are trying to advocate for a more, to either for repealing mandatory reporting or for narrowing it. There's an intervention in New York City called Narrow the Front Door. So how do you get involved? I think there's a lot of networks and like-minded people, but also I think each one of us has a different role, and sometimes your role is doing the research. Sometimes the role is educating trainees. If you're a social worker and you're educating a student and explaining to them what the cost might be. And another thing that we can do is kind of just have conversations in the clinical setting of what are we expecting that this report might result in, and does that actually correspond with what CPS actually does? So if you're reporting a child because you're worried about their teeth and you're worried maybe there's some dental neglect, the child is not going to get dental treatment just because you report it. So perhaps there's a different way to get to the outcome you want. Of course, all the while you must abide by all state laws. That goes without saying. But we also know that people do report much more than what is required by the statute.
Our time has flown by quickly, but let's do one more question about anonymous reports, anonymous reporters. Is there evidence behind whether anonymous reports are helpful?
I don't believe so.
Is there evidence that they're not helpful? Do we have information on that?
I think there are some studies that show that anonymous reports are less likely to be substantiated, but I'm not an expert in that. I actually just looked at a report this week that seemed to say that they're less likely to be substantiated, but that's kind of all I know.
Got it. Very good. Well, you know a lot. Thank you. The applause in the background is for you, Mical. Thank you. That was a wealth of information. And to everyone, there will be a subsequent dialogue that you can participate on. You've received communications about this webinar. You will also be receiving communications about a dialogue that will enable all of us to talk freely about the many, many questions that Dr. Mical Raz has raised here. Thank you, Mical. Thank you.
Yeah.
And thank you all for being a part of this. We'll see you next time. We'll see you for that dialogue. Thank you all.